Hello friends, let us discuss about the easy way to understand the brainstem syndromes. As you already know, the nerve tracts in the brainstem run along the long axis of the brainstem, whereas cranial nerve more or less pass right angle to the long axis of the brainstem. Many ascending and descending tracts in the brainstem they decussate at different level. So a lesion affecting the descending tracts before the decussation result in contralateral opposite side hemiplegia. For example, pyramidal tracts which cross at the level of pyramidal decussation in the lower medulla will result in contralateral hemiplegia. Lesion affecting the sensory tracts like spinothalamic tract which cross at the level of spinal cord, medial lemniscus which cross at the level of lower medulla, and the trigeminal lemniscus which cross in the pontomedullary region, they produce opposite or contralateral hemianesthesia. So you can see in the figure here, you can notice how these different tracts cross here. You can notice the pyramidal tract is decussating at the part of the lower medulla, whereas these medial lemniscus will cross at the medulla at the level of sensory decussation. You can see. So whereas these spinal tract they cross at the level of spinal cord. So these result in contralateral hemianesthesia or contralateral hemiplegia. If they involve motor tracts, it will result in contralateral hemiplegia. If it involves the sensory tract, it will result in contralateral hemianesthesia. Okay, so you can see here the cranial nerve always travel right angle to the long axis. They emerge from different parts of the brainstem, and involvement of particular nuclei of the cranial nerve help in location of the lesion. So simply remember there are 12 cranial nerve, 1, 2, 3, 4. They are above the pons, 5, 6, 7, 8 they come from pons, 9, 10, 11, 12 they come from medulla. As you know, 1 and 2 are directly derived from the brain itself. So 3 and 4 come from the midbrain, 5, 6, 7, 8 come from pons, 9, 10, 11, 12 come from medulla. Next, coming to the rule of 12 here, motor nuclei. You can see 3, 4, 6, 12. These are all are the motor nuclei lying along the medial line or paramedian position and lie ventrally. Nucleus may be lying at any level, but the emergence of the cranial nerve is from the ventral and median zone of the brainstem. So to remember this, you can remember 3, 4, 6, 12. What is the common thing about them? They all have 12 in their tables. 3 4s are 12, 4 2s are 12, 6 2s are 12, 12 1s are 12. So remember 3, 4, 6, 12 are median and they are motor nuclei. Motor nuclei are medial. Whereas sensory nuclei like 5, 7, 8, 9, 10, 11, they are present laterally on the side in the pons and medulla respectively. And you can notice here, you can see the red colored areas which are the motor nuclei lying in the paramedian or medial position, and you can see sensory tracts are on the side or lateral. So remember the mnemonics for the medial and ventral brainstem lesions as 3 M's. That is, it involves motor nucleus, which are the nuclei having these motor fibers here 3, 4, 6 and 12 belonging to general somatic efferent column. Then motor tracts like corticospinal tract, or also we call it as pyramidal tracts, resulting in upper motor neuron paralysis of these tracts and produce contralateral hemiplegia. Medial lemniscus, it carries the fibers from the posterior columns, result in sensory loss of touch, pressure, vibration. Sometimes even medial longitudinal fasciculus is involved. So remember here the ventral and median lesions of the brainstem involve motor nuclei, motor tracts and medial lemniscus, result in appropriate symptoms and signs. So example, the involvement of third nucleus is called as Weber syndrome, where there is ipsilateral oculomotor neuron palsy, contralateral hemiplegia. Sixth nerve, abducent Raymond syndrome, ipsilateral this abducent palsy, contralateral hemiplegia. 12th nerve, medial medullary syndrome, ipsilateral hypoglossal nerve palsy and contralateral hemiplegia with involvement of medial lemniscus. Next, coming to the lateral brainstem lesions, remember as side and remember 4S. S for side, lateral, and S for these all nuclei. They involve sensory nucleus of which cranial nerves which lay on the side or lateral? 5, 7, 8. That is found in pons, 9, 10, 11 in the medulla. And they also involve spinothalamic tract or spinal lemniscus. Remember, spinothalamic tract as SPT, resulting in loss of pain and temperature, P and T. Sympathetic chain resulting in the Horner syndrome. Spinocerebellar tract resulting in ataxia and asynergia. So this is about the lateral brainstem lesions involving predominantly the sensory tracts and sensory nucleus. Remember, they may also involve some motor nuclei, but predominantly they involve sensory nuclei and sensory tracts. Coming to the blood supply of the brainstem. So once you notice here the parts of this brainstem, there are three parts: medulla, pons, and midbrain. Medulla is supplied by vertebral artery. Basilar is by the branch of pons is by the branch of basilar artery. Midbrain is by the branch of posterior cerebral artery. And you can notice here two vertebral arteries are joining to form basilar artery, which is lodging in the basilar sulcus of the pons and giving rise to anterior inferior cerebellar, pontine branches, superior cerebellar, and posterior cerebral arteries. You can see here. So vertebral artery will supply medulla via anterior spinal artery and posterior inferior cerebellar artery. You can see anterior spinal artery is supplying the ventral and median zone, and it is usually involved in medial medullary syndrome or Dejereyn's syndrome. Posterior inferior cerebellar artery is a branch of this vertebral artery supplying the lateral part of the medulla, resulting in Wallenberg's syndrome involving sensory nuclei and sensory tract predominantly. And coming to the blood supply of the pons, it is by the pontine branch of the basilar artery and anterior inferior cerebellar branch of the basilar artery. Here you can see basilar artery. The obstruction of basilar artery results in locked-in syndrome, whereas involvement of pontine branches result in the medial pontine syndrome involving the abducent nuclei, Raymond syndrome. Anterior inferior cerebellar artery is involved in lateral pontine syndrome like the Millard-Gubler syndrome, Mary-Fox syndrome. So those are involved. Coming to the midbrain, the blood supply of midbrain is by the posterior cerebral artery involving the striate and branches.